But robot in medicine come to the world in 1985, done by Dr. Yixen Kwao at Long Beach Memorial Hospital. They use to operate the head surgery. And then in John Hopkins, they tried to integrate robotic in 1992 for total hip and total knee replacement for surgery. But the most popular robotic in the world is from the we call the Da Vinci surgical system. That is the minimally invasive surgery. In 2018, I went to London for like a Hamlin meeting about robotic surgery. They just launched the latest like a Da Vinci method, Da Vinci machine, Da Vinci robotic that have the single port. This is the machine of Da Vinci. The single port, okay, for like a surgery. How about robotic for hair transplantation? Next.
With over 10 years of research and development, the ARTIS robotic system provides outstanding results in a minimally invasive procedure.
This is a picture of the ARTIS robotic.
3D image processing locates and tracks the precise location of each follicular
This is
unit,
follicular unit
on the scalp. Using sophisticated algorithms, the system can track hundreds of follicular units in real time while identifying their
concept.
Angle.
It will track
position, the system rapidly while identifying their length and angle.
The concept about the robotic, it will track the origin and the edge, the end of the hair, and then they will calculate the angle of the hair, and they will track the hair. You see in the picture, this is a grip that we call the extensor. It will like a claw that will stretch the skin, and then they will track the skin, track the hair follicle, and then they will program to randomize harvesting the hair follicle. Okay, this is the concept.
Angle. Guided by a physician, the system rapidly dissects individual follicular units for transplant.
They will randomize.
This precision allows hair to be removed without the linear scar associated with most transplants. So the patient's existing hair would take natural grouping of hair on the scalp, using linear scar associated with most transplants. So the patient's existing hair retains its natural look. The hair is then meticulously transplanted by the physician into the thinning areas. This hair will begin permanent growth in about 6 months.
Okay. Video. Okay, next. Sorry.
This is a representation of how the ARTIS robot works. First, it selects a follicular unit. Then the arm lines up parallel to the emergent hair. And then first it goes and scores the skin with a sharp punch. And then a dull, rapidly spinning punch goes around it to separate the follicular units very accurately from the surrounding tissue.
Can you see the video? Dr. Mukesh, could you please?
Yeah, yes, we can, yeah.
The concept for robotic is used with sharp punch and dull punch. They have two set of the This
is a representation of how the ARTIS robot works. First, it selects a follicular unit. Then the arm lines up parallel to the emergent hair. And then first it goes and scores the skin with a sharp punch. And then a dull, rapidly spinning punch goes around it to separate the follicular units very accurately from the surrounding tissue.
Okay. So the concept, they have two sets of the skin, but the second is down punch to dissect the follicle. Okay, this is two steps. And this is a picture of robotic. You see, if robotic, they must use the grid or we call skin extension. So when you do, sometimes there is some like a space between each grid. Each centimeter, and each grid you can harvest around 100 to 120 follicular units per each grid. Okay. Actually, for FUE like this, I perform, this is around 1,500 grafts. I will tell you frankly that the good thing for robotic is that it will good at the center of the scalp. Okay, but at the periphery, it's not so good because there is some angles decompensation that the robot cannot do well. They will have more transaction at the periphery when they're doing FUE. Not so good for robotic that I see from the ATAS system. This is a picture of the graph from ATAS. It's quite the same. And this is another feature of the ATAS. If you have some like ATAS Studio application, the ATAS Studio application, the surgeon will design the hairline, and about the area that they would like to do hair transplantation, and then and then the machine will use the same platform, the same punch to create the hole like you design like this. Okay. Okay, this is the ATAS Studio. In Thailand, the cost of robotic hair transplantation is very high. It's about 40 million baht in Thailand compared to the other system that just only 30,000 baht, 800,000 to 2 million to 14 million. Like divided the benefit, half with the company and the half to the hospital, to the university. So the margin is quite very low in Thailand. This is a comparison of the robotic graph, and this is for power FUE graph. I think it's quite nearly the same, not so different. The transaction rate, I will tell you frankly, for robotic is around nearly 10%. 10% for robotic, especially if you hide at the periphery of the head of the patient. This is the latest version of robotic hair transplantation, just launched last year in ISHRS meeting in Bangkok, in Thailand. They used the new arm. This is a KUKA arm from China, and they input the new cartridge that will insert many hair in each time for like for transplantation. They will harvest and then you put the hair graft there in the cartridge and then they can implant too. This is the latest version of ATAS Studio, ATAS machine. This is how they perform the implantation with the new machine. Okay, I will show you again. Okay. Okay. Comparison. This is claim accuracy is more than like a manual. But in our experience, I think it depends on the experience of the surgeon. If you perform power FUE for a long time, it's good. It's quite good. It's not inferior to ATAS. High definition, stereo vision system, and magnified glass loop. I think it's not much the same, not much different. Okay. 60 time follicular unit time scanning uh, compared to human eye. Okay, just use like a program and computerized machine compared to the eye. System. Okay, this is a picture of system of ATAS and human by surgeon. ATAS have better about 3D photograph based simulation to let the patient to see the result before surgery. This is a benefit of ATAS. ATAS have program to like an area that we call the safe area that it will not harvest too close. It will avoid the risk of like over harvesting from the occipital area. This is the benefit of the ATAS system. But for experienced surgeon, they can also know which is the best density for them to do. Okay, precise and fatigue. Okay, definitely. ATAS have no fatigue. Yeah, but if like a surgeon perform with a good team, it's okay. User interface is like a high resolution digital image. Okay. The punch is like a two set of the punch. We call the blunt punch and a sharp punch compared to the motorized or handheld. They do sharp punch or down punch. Okay. This is like a side making. They can also use ATAS the same platform. Compared to the strip, okay, definitely more invasive in strip and more pain, a little bit more pain, and the scar compared to the strip, the post-op scar is very depend on the skin tension of the patient. Okay, recovery a little bit quicker by ATAS compared to strip. The price, the price definitely in ATAS is quite higher than strip about 3 times compared in Thailand. This is our last research. We doing research and innovation with Dr. Chakrit, Dr. Songpon in engineering, Faculty of Engineering, Mahidol University with uh, Miss Kanchana and Buntarika. We create our Thailand machine, try to harvest and implant. We calculate and we start to do the prototype for robotic that can harvest and implantation at the same time. This is our prototype for doing harvest and implantation with calculation and use like a two sensor to detect the hair follicle and model. Yes. And then move the machine and implant phase. Okay. Our prototype is like a 9.62 second per graph or in within 2,400 2.4 hour we can do like a harvest and implant for 1,000 grams. This is our prototype for hair transplantation by robotic machine in Thailand. This is patent, our patent. Okay, thank you.
Thank you very much, my friend.
Yeah, you're welcome.
I can't see you. Where are you?
Any question that you would like to ask me about the art task or any robot